Hi everyone, welcome back to Injection Insight. I'm Aaron.
I'm Lisa.
And today we're going to be discussing PDO threads. We're going to talk about just the overall, we're going to discuss what they are, the differences between the different types, and then we also have Lisa who had her personal experience as well. Yeah, exactly. So I wanted to just jump into the different types of PDO threads and where they can be placed. So just starting off, there are the smooth threads, mono threads as they're called, and those are mainly collagen stimulating threads.
Mini threads could be too.
Mini threads, so
all
mini, mono, smooth.
Yeah.
Ultimately, they're all the same.
Yeah.
They do change in length. So you might have the minis, which technically the smooth ones are mini, but they'll be longer. So they have ones that you can do for stimulating collagen on the nasolabial folds or on the face or little fine lines around the face, right? But then you have the smooth threads, mono threads that are longer, right? And you can have them if you've had a baby and you have stretch marks on your stomach or you have looser tissue on your belly, whatever it may be, you're gonna go smooth threads, but you're gonna go longer.
Mm-hmm.
So you can, the great thing about the smooth threads, mono threads, all these different names, is that you can place them in multiple areas. So you can place them, the neck for helping stimulate collagen, helping with crepey texture. Under eye, yeah. You can do it for under eye. Mm-hmm. Body, different areas in the body, even on the arms if you have looser tissue on the arms. Those things, the mono threads are great. You just need to know that they are stimulating collagen, so they will take time. Mm-hmm. They will not happen overnight.
It's not that instant, and a lot of people want that instant and they think that they can do the mini threads, but that's not what they do.
Yeah, they do take time. They want that instant gratification. So that's where that education comes into play and inform them, like, listen, if you want just collagen stimulation, that's great. You can definitely do it, but it's going to take a little bit of time.
And it treats differently. Like you said, it's collagen stimulating. Most people, I would say, they want that lift. The PDO thread lift, right?
Yes.
So any pulling, lifting effect is going to be the bidirectional threads.
The bidirectionals, yes. The bidirectionals are one of the loves of my life.
Well, he's the expert at it. This is like his specialty. This is what he loves to do. He does them all day long.
Yeah.
So
I love the fact that I'm in that age of instant gratification as well,
Aren't
right?
we all?
Yeah. So I love the fact that I'm able to see that really big difference on the client and really lift an area that's bothering them. They come in like, oh, I have these folds, or I have looser tissue on the neck, and we go with those bidirectional threads. And obviously, per person varies how many you need and what areas you place, which that's that consultation part of it. But we're able to really lift and help them turn back the clock. Mm-hmm. Right, so it's great. And so the bidirectionals are different than the smooth threads, and we kind of touched on it, but basically they're these longer threads and they have these little barbs, and the barbs latch onto the tissue. And when I say bidirectional, there's ones holding up and ones keeping you from going back down. And you can call if that was confusing for you, but you can always give us a call. We can give you more details about that. But basically, it keeps it from going back down. And then as they latch onto the tissue over the course of the year mark, they're slowly dissolving and stimulating collagen. So you're getting the benefits of a smooth mono thread while also getting a lift.
it's lifting, and then it's just going to be more beneficial over time as well because it's building that collagen.
Absolutely.
And then, so how often do you get these done? Like, how long do they normally last?
So I know a big fear for people is that they are scared that they're going to end up with scar tissue and that they're going to end up having all these issues down the road. So look, if you do anything too often, you're going to have issues. You do something too frequently, you're going to have issues. That goes back with anything, fillers, skin treatments, all of it. You do too much, you're going to have an issue. Don't do too much, right? And that's your practitioner's job to tell you, hey, hold off, you need to wait. It's recommended every 6 months to a year for the PDO threads, but with that being said, if it's a different area, that's fine. So say for instance you come in today and we did your neck, right? A few months down the road, hey, I want to lift my nasolabial folds and kind of soften and lift my face. That's not going to affect it. That's a completely different area.
So you can do it right
away.
Yeah,
so when I say wait 6 months to a year, I mean that same area. If you go in and do this area and you want to come back 3 months later and do this area, I'm going to turn you away for your safety and for, you know, the benefit of everybody in that sense.
And I just want to shout out our Instagram, Dermal Beauty Med Spa, because we do have some really good before and after pictures.
Yes.
We just had a client yesterday, I believe.
Yes.
And it was this whole neck area, and literally
my gosh.
right afterwards, it was such a difference. So.
It was, you know, I love what I do, and when I get the results that the client came in for, oh, it's amazing. It's such a great feeling. Yeah. It almost, like, it looked, yesterday's treatment, like, you have to go and see this. It was like, even I was like, wow.
You're like, wow, I did that.
I was like, okay, that happened.
Yeah. For me, I did my upper mid face. My main concern was kind of my laugh lines here, because with age and time, everything starts falling and melting. So yes, I felt like I had this, you know, crease here. So I wanted it lifted up. I wasn't nervous at all, because I trust you, and
you've seen me do it
I've
many
seen the
times.
process.
Yeah.
And I will say, just for me, that helped, because I did know everything that you're going to do before you did it.
You even knew what I was going to say before I said
it. I did. I did. But the only thing you feel, and I tell the patients this as well, you only feel the lidocaine.
Yeah, the lidocaine, I mean, the lidocaine is like a little bee sting, right? It's going to sting a little bit because it's numbing the area, but it does numb the whole area. And we make sure that you're properly numbed prior. I
didn't think it was that bad, though, either, honestly. Yeah, so once you get that numbing in there, you don't feel anything at all. You may feel a little bit pressure, and you do kind of hear some sounds, you know? But that's it. It's I feel like a very easy process. And I think that's a big question too, is like, how long does it actually take from beginning to end?
So with that being said, I mean, it varies. I don't want to say, oh, it's only 30 minutes, it's only 40 minutes, because it varies per person. If you come in and you want to do 4 threads, 5 threads, 9 threads, you know, 14 threads, it's going to vary. But typically, on average, it takes anywhere from 30 to 45 minutes.
And that's with consultation and
that's
everything
with
too,
consultation,
so
with paperwork, with consent, with all of that stuff happening, it's about 45 minutes, which is not long at all.
Okay. And then, so after the procedure, what are the major things to avoid? Just so people can plan.
Yeah,
mention that, and then I'll definitely give my 2 cents after my experience.
Yeah, for sure. So I always, you know, I always send people their pre and post recovery information just so you have it. But I always tell people, if you're going to call and you know you're going to do threads, avoid taking any blood thinners unless necessary by doctor's recommendation. You want to avoid that. You want to also avoid any like alcohol, anything like that that's going to thin the blood out.
And this is all before
this
the
procedure? This is all prior. Afterwards, you want to avoid any strenuous activity for at least a week to 2 weeks. So, you know, don't go and get threads and then decide to go dirt bike riding. Just don't do that. Yeah. Don't go snowboarding or sledding. Nothing crazy. Just, I tell people, look, you're having a procedure done on your face. You don't want to risk it loosening or risk any complications for it. Just go home, rest a little bit.
Yeah.
You don't want to go and get any facials or massages that's going to risk it.
Manipulating the area.
Manipulating the area. Yeah, because you're going to affect it. You know, you could do some ice to help with the swelling as well. Some type of antihistamine that's going to help the body from, you know, getting any swelling or reduce the risk for major swelling. And yeah, I mean,
I think it's so important to touch on that this is a medical procedure.
Yes, and people.
So it's just not.
So
in and
people
out,
tend
just,
to not take it as serious. Sorry to cut you off, but people don't take it as serious as it is. It is a medical procedure. This is a full-on situation. You don't want to come in, you know, thinking it's like, you know, you're coming to get a facial, because you're not. There's things that you need to do, things that you need to avoid, and you will receive all of those aftercare instructions in detail. And we also are always there for our clients afterwards. We give our cell phone number to the office that we are with at all times, so we have your back. You have questions, you heard a click, you feel like there's something off, or you're not quite sure about something, I will give you that answer. I will let you know, like, hey, this is normal, this is not normal. Hey, you need to come into the office, or you're totally fine. We are here for you.
Yeah, plan accordingly before, after, because you're spending the money, you're taking the time, you want the best results, so definitely plan accordingly. You know, for me, I did it on Christmas Eve because I knew we were going to be off for those next couple days. I froze my gym membership. I did all these things because I did not work out for the 2 weeks afterwards. I really wanted them to settle. I try not to make the big facial expressions, anything like that, because I just wanted them to be there. I didn't want anything to move. I'll say right after the experience, because we went pretty high up, right, into my scalp. So I did experience, and I know you tell your patients this too, some headaches. It was mild headache.
Yeah,
I
that's
wouldn't say it
common.
wasn't anything bad because obviously it's going up into your head. I just took Tylenol.
Yeah, as long as
and
you're not
I was
allergic,
fine.
Tylenol's
Just
totally fine.
resting. Yeah. And I took those 2 weeks just to really rest. One thing you had mentioned is the clicking. And I know a lot of patients, they'll call back and ask about that.
Yes.
So can you explain that and what that
So,
can
I mean, the clicking is basically the barbed thread settling into the tissue. It's very normal. It's normal, it's gonna happen over the next week or so. Some people experience it more than others. It's very normal, it's nothing to be alarmed about.
You kind of just hear it, right?
Yeah.
You kind of hear a little click in your
How would you describe the clicking?
It's kind of weird because I told him about this the other day. I felt it on this side a little bit, but I kind of liked the feeling. It was like weird. I'm weird like that. But no, it's not anything aggressive or loud or scary in my opinion.
And as long as you know
but
to expect it, you don't need to worry about it.
Managing their expectations, people, like what you're gonna like feel and hear afterwards, I think is important. And then too, just know maybe one side might be a little more sore than the other. You know, it's all kind of normal, and you give people like a good 2 weeks, right, to
And we
have
always do a
everything settle
follow-up in
and-
2 weeks, check everything, see how everything's settling. And just making sure that you know what to expect so you don't panic.
Yeah, and then one other thing too, to kind of expect afterwards is you don't want to sleep on your side.
Yes.
So
I always
training
tell people
yourself.
it's good to get like a pillow, depending on obviously where you place it, but typically you want to get a pillow, kind of wedge it in the back of your head, so when you turn, if you're a side sleeper, you're not going to go and sleep directly on it.
Yeah.
And that's going to help the process of the healing, so then that way it's not going to constantly be tender because you're re-injuring it because you're like sleeping on it or
Yeah.
being rough with it.
Yeah, which, I mean, sleeping on your back, right, anyways, is great for your face. So I was a side sleeper, I guess I am, but since this procedure, I've kind of trained myself more to sleep on my back, which is good in general, right, for your face,
Yeah,
so.
I mean, I'm a side sleeper. hands down.
I know, it's a hard habit to break. And since you are the, I guess, thread guru, I would say, because you love doing it so much, you do have an ebook that you just wrote.
Yeah, we have an ebook on our website, dermalbeautymedspa.com. And if you're interested in reading it, getting some information about the threads, you can go online or give us a call and we'll.
And this would be more for somebody in the field already that is wanting to do it, right?
This is like a client that wants to kind of know some general information about about different areas that can be treated, and how it can affect you.
Perfect, kind of what to expect
Yeah,
and everything like that.
it's not too the ebook is very it's not too technical, so it's a very easy read, give you some information, and you won't feel overwhelmed.
And this is coming from somebody that does it, a professional, credible, and better than just watching YouTube videos or anything like that, right? You're getting those answers. And do you have a discount or anything for that book if somebody wants?
Absolutely. So for the podcast we're doing Insight 50, and that's going to give you a discount for your ebook.
Perfect.
All right, everybody. So we're on social media, Instagram. Follow us, like the videos, and you can always DM us, reach out to us. We're on Facebook, Instagram, YouTube.
The podcast.
And the podcast.
Please stream the podcast. And if you have any questions to reach out to us, we would love to feature that on the next episode.
Absolutely.
And we'll talk to you soon. Thanks.
Right.